Welcome back, my people. We are back to our major topic of discussion, whereby we were discussing about diarrhea, and it just came as a subtopic that for the better part of the past few days we are discussing about dehydration, which was very important because it affects many people while they are diarrheaing, and maybe you might not know whether you are dehydrated or not. But now I know every one of you who has been following this channel knows the signs of dehydration and what to do when you are having diarrhea. We have also discussed the home remedies you can apply. We discussed about how you can make a homemade rehydration drink and all that. So my people, let's continue sharing, subscribing, liking our videos, and make sure our videos reach as many people as possible, because I know it will help somebody somewhere. And if you share, you will be assisting somebody somewhere, a kid somewhere, a relative somewhere. So let's discuss about diarrhea in babies and young children. Those are the most affected age groups, because maybe their immunity is a bit low, they are still growing, they eat or take a lot of contaminated items. They are prone to contamination because they touch here and there, their hands in their mouth. So children are particularly susceptible to diarrhea and dehydration. They are susceptible. In other words, they are prone, or they are at a greater risk for diarrhea and dehydration. Seek medical advice if you see symptoms of dehydration, such as number 1. So if you see the following symptoms, don't hesitate. Just seek a medical advice. Take your child to a healthy facility if you see the following symptoms. Number 1, decreased urination. Number 2, dry mouth. Number 3, headache. Number 4, fatigue. Number 5, lack of tears while crying. We have dry skin, sunken eyes, sunken fontanelle. We have sleepiness and irritability. In short, those are the signs of dehydration in babies and young children. And as we said, dehydration can be very dangerous. That's why I'm saying, when you see those symptoms, make sure you see your healthcare provider. So, what are the treatment options available for diarrhea? Treatment options available for diarrhea. All the treatments are always aimed at replacing or hydrating, replacing the lost fluids or hydrating. Drink a lot of water or electrolyte replacement beverages such as sports drinks. Drink a lot of water or electrolyte replacement beverages such as sports drinks. In severe cases, you may get fluids through intravenous or through the vein. If bacteria infection was the cause of the diarrhea, your doctor may prescribe antibiotics. As we said, management depends on the causative organism, or it depends on the cause. So if the cause was by bacteria, obviously you will get antibiotics. Your doctor will decide on your treatment based on the following. So what are the factors that your doctor has to consider before he or she gives you the right treatment? Number one, severity of the diarrhea related conditions. How severe is this diarrhea? Number two, frequency. Frequency, or how many bowel motions are you having? Frequency of diarrhea and related conditions. Number three, degree of your dehydration status, because sometimes you may have a mild dehydration which doesn't need an hospital admission, or which simply doesn't need the intravenous fluids but taking orally if you are able to retain. The doctor will consider your health status, will consider your age, will consider your medical history, will consider your ability to tolerate different procedures or medications. Ability to tolerate or withstand different procedures or medications. He will consider expectations for improvement of your condition. Expectations. Obviously, when somebody is sick and goes to a doctor, he or she expects what we call quick recovery. Quick recovery. So that's why we are saying the doctor will consider the expectations of improvement of your condition. Let's see the diagnosis of the cause of diarrhea. How will you tell the causative organism for the diarrhea you may be having, or the diarrhea your child may be having? Physical exam and medical history. So through the physical examinations and the medical history the doctor gets from your relative or your mother, this will guide him into diagnosing diarrhea. We have laboratory tests to examine urine and blood samples. Number three, we have diet elimination tests. Diet elimination tests to determine whether allergy or food intolerance is the cause of the diarrhea. Diet examination tests to determine whether allergy or food intolerance is the cause of the diarrhea. We have imaging tests to check for inflammation, and structural abnormalities of the intestine. Number five, we have stool culture. Stool culture, obvious, to determine the causative organism or microorganism, or to check for bacteria, parasites, all signs of disease. Number six, we have what we call colonoscopy, to check the colon and signs of intestinal disease. To check the colon and signs of intestinal disease, we have also sigmoidoscopy. Sigmoidoscopy, to check the rectum and lower colon for signs of intestinal disease. Sigmoidoscopy, to check the rectum and the lower colon for signs of intestinal diseases. A point to note, colonoscopy and sigmoidoscopy are helpful in determining if you have intestinal disease or severe or chronic diarrhea. Sigmoidoscopy and colonoscopy are helpful in determining if you are having intestinal disease, severe or chronic diarrhea. This marks the end of our discussion today. And in our next video tomorrow, we'll be checking about prevention or ways of preventing diarrhea. Let's continue keeping the support on. Let's subscribe, like, and share our videos so that they may be recommended everywhere in the world. Have a good evening.